As I've been introduced, I'm Maulid Mwatawala. I'm the Deputy Vice Chancellor for Academic at Sokoine University of Agriculture of Morogoro, Tanzania. Professor Riziki Shemdoe, who was the Permanent Secretary at the Ministry of Livestock and Fisheries, will be presented by Dr. Edwin Mhede, who is the Deputy Permanent Secretary at that ministry. The other panelists are the same. So without wasting much time, let me quickly set the pace for this session. We all know that the link between agriculture, nutrition, and health is crucial if we are to realize the Sustainable Development Goals. However, we know, despite this realization, we are far from achieving that. And we think one of the main issues would be having comprehensive policies to address that intersection between agriculture, nutrition, and health. So with us, we have the panelists who are going to discuss with us today. I've already introduced Dr. Edwin Mhede, but we have with us today Dr. Wanjiku Gichohi from World Fish. Welcome. We also have Dr. Salom Hamed, who is a Director of Fisheries from Zanzibar. And we have Patrick Kormawa, who is the Director of Climate Smart Agriculture and Food Security, Office of the President, Republic of Sierra Leone. So these are going to be our discussants. And quickly, the objectives will be to explore the effective policies that can address this intersection that we're talking about, the link between agriculture, nutrition, and health. But we would like to know or to hear from success stories where this has been done. And these will be also shared by our members here. But we'd like to know what are the structural as well as institutional mechanisms to make this thing happen. And finally, the role of academia, especially science, in generating the evidence that is needed to inform policy that can address this intersection of ANH. So without wasting much question, I'll directly go to Deputy Permanent Secretary, Dr. Mhede. We know you are now implementing what we call livestock transformational action in Tanzania. And it mentions, among other things, veterinary health, as well as safety standards to food. Now, what do we need to have an effective policy to address such an intersection as related to agriculture, nutrition, and health? Karibu.
Thank you so much, Mr. Chair, for affording me an opportunity to be the first speaker in this session. But before that, allow me to sincerely thank the organization of this meeting, of this conference rather. I have been with some of you. I can see some familiar faces for the past 20 years. Although after the departure, I never met you. I can see the likes of Professor Ulasa. I have seen colleagues from Sokoine, many of them. Yeah, so I was talking to Professor Kinabo this morning that I'm home. Now that you are speaking about the public policies on how we should be able to come up with policies that respond to the intersection between the productive sectors and the consumers. The challenge which I have seen, and I think it's not only particular to Tanzania, it is likely to be applicable to many other parts of the world, is this context of working in silos. Mr. Chair, sorry to say, even when you're asking me the question, you're asking about the livestock policy. So if you concentrate on livestock policy alone, that shows the way we have been working like one sector, instead of having sectoral interlinkages. Then why policies? Audience, let me ask you this question. Why we need policies? We only need policies if we have got market failures. We only need policies if there is a coordination failure. If there is no market failures, there is no coordination failures, sincerely speaking, we don't need policies. This is a bit strange, but that's the truth. Now, the point will be, as I speak to the academic audience, it is the duty of the academicians and researchers to explore and find out what are the specific failures that exist along various value chains that call for an invisible hand. An invisible hand here is the government. These are policies enacted by the government. But it is suffice to say the agricultural sector in Tanzania, and particularly including other parts of Africa, they are the mainstays of our economy. And you read the policies, they are more into production, not necessarily into the consumption part of it. I think in so doing, that's why you see cases of malnutrition, you see the cases of micronutrients, particularly in the Big Four. In the Tanzanian context, I will speak to the Big Four regions where we produce more grains, but you could see the people from those areas are starving. So, what can be done to cut that long story to make it a bit shorter? I think the first one, we should have what we call system thinking. Let us think, comprehensively by coordinating, by ensuring that all specifics that have to move beyond production, the specific that require to go beyond production, and especially emphasizing on the nutritional aspects and the cross-sectoral coordination. In that way, we will be able to ensure we have got inclusive policies, not only for production, but also to serve the society. I'm aware that we have got the linkages, but they're not strong enough. This is my take, this is my understanding. And those areas that can specifically be used or can be addressed, the policy coherence and aligning the food system intervention with the climate smart or sensitive, nutrition sensitive goals be considered. Another area, although I have already spoken about, the data-driven policy decision making. So if the policy was designed based on a single silo without taking into account the other important aspect, the consumption part of it, and especially ensuring the quality of the foodstuffs that we want our people to consume, then I would say the policy that we are having, maybe, if they're not speaking to each other, we are in this room responsible for that. Because it was supposed to be provided for by the technicians to say, not just having this side, but the other side. So the question here, Mr. Chair and the audience, are we always up and running, providing technical suggestions to say this livestock sector, this agricultural policy, for example, has to speak not only in itself, but it has to speak across various other aspects of the social life. And another aspect which is more of because I can't speak a whole thing, I'm sure we'll have another chance. So we will be having very well-balanced, comprehensive policies that address almost every aspect. Mr. Chair, I have gone through several areas only to find that well-drafted policies can contribute only 10% of what the society desires. The 90% that is remaining is what we call deliverology. How do we prepare our delivery mechanism to ensure that those good policies, they're actually implemented? The government, for example, will promise, will prioritize through policies, but what matters the most is how do we actualize? So having good policies here, inclusive policies to address both the health, nutritional aspect, and the food systems is one thing, and it's only 10%. But the deliverology, the capacity to translate into action, I know it's not part of this session, but I wanted to emphasize, we have good policies. Let us have good policies, but let us not forget on how we can really have a strong institutional system that will implement the policies so that the society can benefit out of it. Let me end up here, Chair. Thank you.
Yeah, thank you so much. I mean, you have given us a very interesting example of areas where they produce a lot, but they still suffer from malnutrition, and you have mentioned about the cross-sectoral linkages. But how ready are you people working in the government to break the silos? You are from the livestock, but you have to work with people from nutrition, health, agriculture, And even the Minister of Agriculture in Tanzania, once he was Minister of Agriculture and Livestock, Minister of Agriculture alone, fisheries here and there. So how ready are you to work together to move out of the box and break the silos to address these linkages?
Thank you. Yeah, I think it's a process. It is a process from the fact that we've got mandates. So when you have a government instrument, for example, it points out clearly this ministry will be responsible for 1, 2, and 3. But if we deliver as a government, it doesn't mean you cannot work with the others. Maybe let me share my current experience, we from the Ministry of Livestock and Fisheries. So we found out the Agricultural Ministry is trying to introduce the irrigation systems across the country. And traditionally, we thought having fishery production, I am from the fisheries now, we will go to the lakes, the ocean, and probably these large rivers. But now we have changed that whenever the Ministry of Agriculture introduced the irrigation scheme, we have what we call mpunga samaki. Mpunga samaki means there is a rice farming, but we integrate with small ponds where we can produce fish. You can raise fish through aquaculture. And then we are not only doing that, we are now trying to extend to say areas like Gabimori. Gabimori is in northern part of Tanzania, in Mara, where we try to ensure those small water is used by livestock, and also they are used by people for domestic consumption. We go and restock fingerlings, the fish fingerlings. So how do we do that? Actually, it emanates from the mandate itself, that this is your portfolio. You cannot cross over. But I think we are trying to break those cycles, those silos, to say, let us move out, work together. Yeah, so thank you so much, Prof.
Okay, thank you so much. Dr. Wanjiku, we know that the World Fish has recently published a book called 50 Years of World Fish. So you're celebrating the long journey from where you started. And I read that you have evolved from focusing solely on fish, and now you are taking a holistic approach. So just like we are doing now, integrating ANH. We work in 20 countries now in Africa, Asia, and the Pacific. So you have a lot of, the World Fish has a lot of experience in international policies through these engagements. So can you give us an international perspective on policies that integrate what we're talking about, agriculture, nutrition, and health? What's the international perspective? Yeah.
Right. Thank you, Chair, for this opportunity, and I also want to thank the ANH team for organizing this conference. Despite the fact that I'm the only woman on the panel, it would have been good to have more women. He says strongest voice, supported by all the other women in the crowd. I think it's important, first of all, I want to reframe first, the question that you've asked when you think about policy at the intersection of agriculture, nutrition, and health before I answer it. I think the challenge first that I'm sure all of us are aware about working in this area is that our starting points as agriculture, as nutrition and health are different in some sense. Different at who we think we are working with and who we are targeting with, and therefore the language that we use, and that also spells out in our policies. So when we think about agriculture often, even as researchers, and I'll link that to policy, when I work with agriculture people, as someone in public health and nutrition, they talk about farmers and producers. And in my mind, I'm thinking about consumers, right? And I'm also considering the farmers and the producers as consumers. I realize often those in production are talking also about the producers as if they are not part of the consumers. So they are producing for a market, and that market is who we are calling consumers, right? Health is talking about patients. So they're starting from the point of people that are often already sick, right? So we have these things that are playing out in practice, but also in policy. The thing that unites these three groups, the farmer, the producer, the patient, is the food, is the diet. So when we're doing policy formulation, what our thinking is, and I'll widen this to not just World Fish, but as CGIAR and the program on better diets and nutrition of the CGIAR is we need a rethink in how policies are formulated and implemented, starting with diets, because this is the uniting factor among these three things. When we start with diets and work backwards, then for example, when we formulate food-based dietary guidelines that have considered planetary boundaries and so on, we can work back to producers and say, then what do producers need to then make the diet more healthy? What is missing in diets nationally? And then the question around how do we incentivize production of nutritious foods and so on, and policies that support us then are answered. How do we work with supply chains to respond to the issues around diets? And I think that's what generally the CGIAR and the Better Diets and Nutrition Science program is trying to do, is to within the CGIAR, in the research we do to inform policy, but also outside, ask for a rethink and a reframe around how policies are formulated. So the farmer should be incentivized to produce not only staples that are often the ones that are subsidized and so on, but other nutrient-dense foods. And even when you think about staples, is how do you incentivize things like biofortified crops and so on and so forth. I think the second thing that I also want to mention and echo what my fellow panelists said is thinking about moving beyond not just a policy formulation. I think there's been a lot of momentum around thinking about policy at the intersection of agriculture, nutrition, and health. And when you think especially about low and middle income countries, a lot of this momentum is from the SUN network being formed, from the UNFSS process and so on. And you see, for example, Tanzania has a multi-sectoral nutrition action plan that is in its second phase and tries to bring sectors together, where we need to strengthen the impact of these policies is in the implementation, not just at that national level where the ministries are working together. It's down to the community level that we're changing the lives of that woman of reproductive age that we aim to target. So it's looking more at implementation and research informing how policies are implemented beyond the national and going to the subnational level. And a lot of our research also is targeted towards that, looking at implementation, enabling measurement and attribution of the intersectionality of these policies and the impact they have on nutrition. Thank you.
Okay, thank you so much. So it's like, it's not about having very well-written policies, but it's beyond that. That's what we're echoing from what the Deputy Permanent Secretary also said. So if I have a follow-up question, what are the enablers to make that integration work, apart from the policies? So what should be the enabling environment to make it work?
Wow, that's I think it's a question that also I hope would open up to the audience to give examples about enablers. I think one of the enablers that we see, I'll give the example of Malawi, and I'm sure there are people from Malawi here, and I believe the same is happening in Tanzania, is first the formation of coordination mechanisms that work, and that these mechanisms, again, are just not at the national level, but finding ways in which they permeate down to the level of the district or the ward and so on. So in Malawi, for example, you have district nutrition coordinating committees that have representation across various sectors, not just agriculture, nutrition, and health, but they also have people from social protection, from education, from trade, who come in and have regular meetings and so on. Where the strengthening is needed is within these coordination mechanisms when they meet together. So for example, when we would have meetings, because we would be part of, as researchers, part of the district nutrition coordinating committees, is they report that they are working multi-sectorally. But what is really happening, for example, in these meetings, the agriculture officer is still coming and reporting on the acreage under maize, right? That's the metric they're using to say that they're impacting on nutrition. And the nutrition person probably is just reporting around vitamin A supplementation because that's what is funded. And the health person is there talking about immunization, but who is harmonizing this data to look at exactly how is this being combined and looked at to be able to attribute this to changes in stunting and so on that you're seeing? So there's a coordination mechanisms as one enabler of enabling, of strengthening policy action, but there needs to be more in terms of results, follow-up and monitoring and evaluation and identifying suitable metrics to be able to have attribution to change. Thank you.
Okay, thank you so much. So there is something to do with coordination, because I've shown that even where you have all these policies and mechanisms for integration, you still have people thinking within their. So thank you so much. I'll have another follow-up maybe later on. Dr. Patrick Kormawa, you are sitting very close to the High Office in Sierra Leone. And I know recently His Excellency, President of Sierra Leone, Julius Bio, speaking in Ibadan, Nigeria recently, he emphasized that food security is not about just food. There has to be linked to health, among other things, and he really stressed that. So what evidence, I mean, you are the advisor or a close person working to the High Office and giving an example that is of global perspective. What evidence is really needed? Because you need strong evidence to convince and push through the agenda. So from your experience, what evidence is highly sought by the High Office to promote action at the intersection of agriculture, nutrition, and health? Karim.
Thank you. Thank you, Mr. Chair. And since this is my first time intervening officially, let me thank the ANH2025 organizers, and in particular also the sponsors. I mean, looking at the quality of participants, I think you're doing a fantastic job, and your sponsors also are investing in what I refer to investing, because when you invest in knowledge creation, you're investing in lasting capacities that will support the development of countries and nations, and by extension, the world. Having said that, and to frame the answer, let me give you a context, because answering without stating the context may be looking at academic. Let's look at the policy-making processes and the influencers. We have the global influencers, the SDGs. At the Africa level, we have the Africa 2063. At the national, at the regional levels, we have regional priorities for SADC, for ECOWAS. And for countries, they have their national development plans, cascaded or split into medium-term plans. So when you look at all of these, we also have partnership, national organizations, and development partners. So all of these, for the policymaker, interacts. And coupled with that is the political will, the political manifesto that the president came into power with, or the minister is implementing. So the kind of data, the kind of information also depends on where and for what purpose His Excellency is going to give a talk. And for us in Sierra Leone, linking to your statement that our president was in Nigeria, I was with him at IITA. He has 5 key agenda priorities, but priority number 1 is what we call Feed Sierra Leone, which again translates into Nourish Sierra Leone. So food security linked with nutrition and climate change are key in that package. So if His Excellency is going to the African Union, we need data that helps him to convey that message at the Africa continental level on how the feed salon is changing lives, creating jobs, helping to reduce stunting, malnourishment, and the like. If he's talking at the IITA Ibadan, he talked to the scientists on the kind of nutrition-sensitive technologies that are required to support the feed salon. If he is talking to the population of Sierra Leone, of course, he will talk about how the feed salon is creating lives, improving productivity, creating jobs, getting young people into jobs. His Excellency is going to talk to the development partners, for instance, talking to the UN. Depending on the UN he is talking about, we prepare him to get the complete data that he needs, if it's FAO, if it's UNDP, or WFP. So one has to understand the policy layers for a policymaker. But for us scientists, for you the scientists, I think one area you can be very useful to us is at the time or before the time we develop the national development plans, because this is the time when priorities are set. And if soil degradation is your problem, it's our problem, the technologies that you have developed, the knowledge that you have at that time, we will need it to prioritize soil health in that document. If the issue is related to maybe fisheries, let me come to my colleague here, that you have a lot of possibility to do aquaculture, but that is not being done, and you've done that research. That time we need that information to set those priorities. So, Mr. Chair, one has to think about where the president is going to talk or the minister is going to talk, but most importantly for researchers who are in this room, we want you to be linked up with at least in your countries, the ministries of planning, because they normally lead that process. So make sure that when you are presenting your reports, they are in the room. I thank you.
Yeah, thank you so much. You spoke of what and when and where, about the technologies, etc. But can you give us at least one concrete example of the type of data that are really needed? Just one concrete example, depending on...
Data on, for instance, in the feed salon, we want to increase agricultural productivity and replace. We import about 20 to 30% of the rice we eat, and we want to reduce that. So we need, for instance, last year we did an analysis and found out that rice prices has declined, so we needed data on prices. Rice importation has declined, we needed import data. Productivity has increased, so we need productivity data. Investment in agriculture by the private sector has increased, so we need data on that. So these are the type of data that we need depending on who we are talking about. That's when we are talking to that the category of clients of the government. Thank you.
Okay, thank you so much. Dr. Salim Hamed, you are from Zanzibar, and we know that Zanzibar is promoting blue economy. And one of the objectives is to make sure that you explore the marine resources, but at the same time, you protect the environment, ocean environment. So what policies should be in place to ensure that ocean health is maintained and at the same time integrated into our agenda of agriculture, nutrition, and health?
Thank you very much, moderator. But also I would like to join my colleagues on congratulate ANH for organizing this very important forum where researchers and academicians and policymakers, we can discuss on issue related to nutrition, health, and agriculture itself. Yes, now the globalists is moving toward emphasizing on health foods, particularly from the aquatic environment. That's why now we are promoting the agenda regarding to the blue economy. So this is one of important aspects on our nutrition, to look on where these resources coming from in terms of environment as aquatics, but how we can protect it and become sustainable, but at the same time, we have very healthy foods. So as you speak, Zanzibar, yes, we emphasize it, and we try to dig it in from the last 5 years by reforming our policies first. Because the previous policy doesn't talk much about aquatic foods as a blue economy, but now we reform it. From 2023, we have a policy for blue economy which highlights and provide a very concrete reason why we need to conserve the environment so that we can have healthy aquatic foods. And then this is important for nutritional purpose because we know a large part of our environment is covered by water. And in any production activities regarding to the agriculture, most of it depend on aquatic resource, it means water. So without having strong policy on conserving it, we will end up with an unsustainable way of producing aquatic healthy foods. So at this point, we emphasize on a multi-sectoral policy. So the production part should be communicating with healthy parts, and also should communicating with users part, final beneficiaries. So once you communicate it very clear in policies and on implementation of it, so you can have a sustainable way of conserving the environment in the name of getting healthy and nutritional food from aquatic environment. Over to you, Chair.
Okay, thank you so much. So you have mentioned the importance of having these multi-sectoral approaches, but at the bottom you mentioned the users. How much do you involve the community? What is the role of community in implementing these policies effectively?
Yeah. It's a very great question regarding to the aquatic resources, particularly I can speak on the African side. We have a lot of aquatic resources, but most of the time we emphasize on fish. We put aside the other important nutritional value foods like seaweed. So as a government, in our policy now, we try to emphasize how we link the community on consuming other aquatic foods, particularly seaweed. Because we know that production of the seaweed is environmental friendly, and also it is a superfood in terms of nutritional. So it can support large population, and then you can have a large production on a small space. So we know that in a community, for example, in Zanzibar, over 90% of seaweed farmers are women. But if you look on the issue of health, nutritional requirement for the women and the child under 5 years, issue of malnutrition. So you find most of it take out as a cash crop rather than consuming it for purpose of improving a nutritional status of the farmers and the families. So now we try to emphasize what we produce can have more value in a community nutrition rather than take it as a cash crops for export purpose rather than consuming it at community levels. So we argue for the researchers and the scientists to come up with a very strong direction for emphasize community awareness in terms of nutritional value of other aquatic foods apart from fish, where the community now they can reduce the issue of hunger and malnutrition based on natural environments we have. Over to you, Jim.
Okay, thank you so much. So I think we are moving on. One of the things that has been agreed here, I think, is that we need to break the silos. And as Dr. Wanjiku has said, the intersection is about food from agriculture, food for nutrition and for health. So that's the intersection where we meet and what goes from there. There has been an emphasis still of multi-sectoral approaches, but an important thing is not having comprehensive, well-written policies, but rather the coordination side of it. You can have policies that are not coordinated, everyone speaking on himself, and in the end we do not realize the goals. There's been an emphasis on community engagement and involvement in implementation of these policies, but also that the kinds of evidence that we need are politically sensitive, depending on times, depending on where they are needed. So they could be about prices, it can be about import, it can be about inputs, depending on the context of that time. Now, ladies and gentlemen, we are also joined by the members of parliament from the UK, 3 of them, and the Lord. And I'm sure one of them, before I open up the Q&A session, I'm sure one of them would like to share also some interest, because these are the policymakers from UK. So can you share something? Yes, please.
Thank you very much. It's a huge pleasure to be here at this conference, and thank you for welcoming us all so warmly. It's been fascinating to hear the comments from today and to understand about the integration of agriculture, nutrition, and health. So, I mean, I guess perhaps I could direct to you what has been found over the week to be the kind of biggest challenge to networking agriculture, nutrition, and health together in a policy sense?
That question has been thrown to me or to the panelists? My work is coordinate the talk. I don't know. I think this should be one of the questions that I'll just open up for everyone to speak for themselves, because we all have different experiences across the week, so we know what has been going on. But as a participant, I would say that it has been an eye-opener for most of us. I'm from agriculture. I'm never much, before this week, I was never much bothered about the health, because this is for the doctors. If I'm sick, I'll go see a doctor. About food, I'll go to a market. If I want food, I'll just go there. But without any regard to that intersection, but without any regard that whatever has to work has to come from very comprehensive policy or policy frameworks, but then also the coordination. And the good example we have, like the one we have in Tanzania, is where, as he said, you have high production, but high malnutrition. It's something that you may not think about it, but it seems things are not working somewhere to integrate these. But as I said, these are the masters. Maybe any one of the panelists can respond to this.
If you may come back again, I was not very clear from him. Sorry, it wasn't very clear.
Thank you. I was asking what you see as the biggest challenges to coordination between agriculture, nutrition, and health.
I think key here is communication. Strategic communication among, the all key players. Because the fundamentals of coordination comes if, it will be good if you are communicating properly. Without, having a well-drafted communication strategy and actually communicate, just sitting in conference like this one, but communicating operationally, communication where things have to happen. I am sure, even if we have got good policies, we will not make it. So for me, key will be communication amongst the key stakeholders. But number two, now taking an example of you coming from, you are the lawmaking machinery, because you decide policies. I guess the parliamentary system of the UK is almost similar to Tanzania or other places historically. Are you able to question the technicians? to say, you know, look here, you have brought these policies before the parliament to decide, or before the cabinet to decide. Have you looked upon how this policy is actually communicating with the other policies? So the problem can be one way, but also it can be two way. So this is what I want to say. So we submit as a technician, but also you decision makers at your levels. I think it is good to see that we are working together. Number 3, let us create a pressure cooker. A pressure cooker will come from the public. So if we engage aggressively the public, create awareness, so that, because here is more of the production. We produce food, we produce whatever to feed the people. But the people who are to be fed, are they having proper knowledge of the nutritional aspects of what they consume? If we create, you know, an awareness and give them the opportunity to air out their voices, then that pressure will, you know, will go to the decision makers at policy and operational levels to say, no, look here, we are deciding this today. We want to enact this law today or this policy, but what is the population speaking about it? Chair, niishie hapo, asante sana.
Thank you so much. I think now it's safe for me to comment after having this. I come from academia, and I would think it is deep-rooted in our training system, because we are so compacted into our own silos, as you're saying, that these are doing agriculture, these are doing nutrition. From day one you are being trained, you are focusing that way. And these are doing nutrition, etc. And the nutrition from the perspective of a doctor is even maybe totally different from the nutrition from a perspective of someone who did maybe a bachelor's degree in nutrition. And then even if you go to universities, you have these labels. He is a food scientist, he is a nutrition scientist, he is a vet, he is a livestock. All these are labels that we put together. And in some cases, you have people maybe working in the livestock sector, but this one is in health and cannot really communicate with someone who is in production. So there are so many silos that have been inbred within us, even in this room, that our thinking has been shaped that way, from the way we have been trained to the way we have been working, ultimately to the way we formulate policies and how we implement them on the ground. But the people, if I come from Sokoine University of Agriculture, the farmers do not know that I'm into food science or animal science or vet medicine. They know I'm from the agriculture sector, and they would like to see someone who will address their problems within that context. So I just wanted to add that. But you have not answered our question. What is your experience, the Lord? Because you threw a question back to us. I respect the Lord, but I have to ask still.
Thank you very much. Well, we've had a great experience here this week, and I think many of the issues around integration of agriculture, nutrition, and health that are faced by people in different countries around the world are also faced by us in the UK. And I think that issue of breaking down the silos is exactly as Dr. Mahedi said. Communication is absolutely critical, and we have to work together to do that, both back in the UK and internationally. And this conference is obviously a huge part of it, by bringing technicians together with policymakers. I think it's hugely valuable. We've also had the opportunity to go out and see some of the research institutes around Dar es Salaam, and also to visit with UNICEF in Zanzibar, projects that are there on the ground showing what integration means in practice. So I think we can all learn from each other, and that's why this is such a valuable conference, and why we're so grateful to have the opportunity to be here with you, to answer your questions and to pose them as well. Thank you.
We thank you so much. So things are already happening in the ground. You see the integration and the coordination, working with the academia, UNICEF, and all these people. So something is already happening. So we thank you so much. Now it's time to open up for the question and answer session. Please be brief and straight to the point, and direct your question to a specific speaker. If it's not a specific question, it's a general one, please say so.
Thank you very much. Mine, currently, we are promoting production. And in the process of promoting production, there's also an increase in the use of fertilizers, particularly inorganic, but also pesticides. Now, this is where my concern is. Awareness, particularly in the community. In most of our African countries, the markets are not regulated. I can even grow my tomatoes and sell directly to my neighbor. I can even keep livestock, maybe poultry, and sell directly to my neighbor. So when it comes to food safety, nowadays the agricultural practices are not complied. People spray pesticides, and within a limited number of days, they are harvested and being sold to the markets. So when it comes to policy, it's very important to find a way on how these can be addressed, not only promoting production, but also looking at the food safety. The question can go to anyone, but this is what I wanted to contribute.
It's a comment, is it a question?
Of course, as you said, the coordinator, that sometimes there are things that go more than to be directed to one person. And by the way, I'm reminded, my name is Victoria Goele from Sokoine University of Agriculture, Tanzania.
Yeah, thanks so much. So SUA has a role to generate that evidence that these farmers spray these without doing this, so that we inform the policy. So you also have a role, but the panelists will respond to your question. There is a hand here. I don't know, where is another mic? We need another assistant, I think, on this side. Can we have someone else to support us on this side? With the mic.
Thank you very much. My name is Maria Angelisho. I work with Tanzania Food and Nutrition Center.
Yes, please, straight to the question.
Yes, mine is about creating awareness to the general public. We have been here talking about ways to make the community safe with regards to use of ultra-processed foods, all this, but nothing has been said about creating awareness on the side of consumers, that they should be educated so that they can make informed choices, because the giant gorilla in the room, they'll always be there producing, but the consumers has to be aware of what is in that food, to what contents, if there are toxics and all this, so that even if they decide to take the products, they know exactly what is in the products. Mine is about creating awareness to make informed choices. Thank you very much.
So that's a comment as well, or you want some?
It is just a comment, it's not a question.
Oh, so we are very safe today. Any other hand? There is one there.
Yeah, thank you very much, Chairperson. It's also a comment for my side. I think the audience needs to know that yes. I'm Justin Urasa from Sokoine University of Agriculture. I just want the audience to know that in Tanzania we have the Tanzania National Multi-Sectoral Nutritional Action Plan, which is under the Prime Minister's office, and now the silos have been broken. Now under that, people from the different sectors work together to make sure that things are happening at the ground. And also there's a relationship whereby the president has tasked people at the regional levels and the district levels through improving nutrition at their areas of jurisdiction. Thank you very much.
Thanks so much, but take note from the experience in Malawi that they said that, but when they come with their reports, they're still in the silos. So that's what Dr. Wanjiku said. We go to that side, there is a hand towards the end, two hands on that side. Yes, Karib.
Hi, thank you. My question is around incentives. We've been talking about using systems approaches for years, really, but I don't think it's become much easier to actually do those in practice. And I'm wondering, what incentives can policymakers provide to help make it easier to bring those with different mandates together? And also, what appetite is there for governance changes to create offices actually similar to the last gentleman's question around coordinating better, bringing people together in government?
Who's going to take it? Is it directed to anyone specifically? No, to anyone. So I think You can pick it. There is a hand, another hand towards the end. Yep.
Excuse me, sorry. My name is Sam. I'm a researcher at the University of Greenwich, and I'm a Kenyan, so I'm reflecting also on the Kenyan challenges. I would pose my question to government officials in the panel. You're posing the challenge as coordination. If you're in agriculture, how often do you sit with the Minister for Health and try to look at where your policies could at least be some synthesis or integration? Or because we can keep here discussing the problem, but you are in the room and you can tell us, do you sit to the Minister for Health as people in agriculture, and do you discuss these issues? Thanks.
Thanks so much. Two last questions before we close the session, and maybe we'll take some other rounds.
Hi,
so there is a hand here. And,
coming
okay.
from Malawi, I think just listening to the panel, my question is on just priorities. You have donor-dependent priorities, international priorities, national, community, and grassroots. You pointed out the communication, but I think at a policy level, it's really difficult to break that and understand how to actually address those priorities in a way that's not just driven by targets, that's not just driven by numbers, but actually looks at the true impact within this space of the ANH space. So I wonder if you have advice on how you've addressed that or ways that you're integrating that. That's not just based on siloed responses from agriculture and nutritionists and health practitioners.
Okay, thank you so much. So basically we have three questions that came from the last three speakers. So if we can respond to those, anyone who can volunteer? You want to start? Yes. You have a mic.
So I'll just randomly pick those that, I think to the last question on addressing, the varied priorities, right? I think one of the things in terms of influencing policy and policy action, and especially for us in research, is to be aware that it's important to frame whatever evidence you have within the larger developmental agenda of the present political system that is there. And I think that is what my panelist was alluding to. And I think one of the, as WildFish or in the CGR, where we've had successes is realizing it's not just communicating that whatever you have will have this reduction in stunting, but what does it mean for human capacity development or the developmental agenda for 2050, 2063, and so on. And therefore, all those hurdles around competing priorities, because often things around job creation or development are things that everyone rallies around and breaks down those multisectorality issues, right? And I think it's also now back to what was being said around communication. I think for us in research, often we assume that once we generate evidence and policymakers have it, it's a very linear process and they should take it up, and then there's that frustration of why is that not informing policy? But it's often how we frame this within the larger agendas within that. Part of, and connecting that to the appetite around governance, there is some piece of work we've done around multisectoral nutrition governance in Kenya, and interesting to us, there was quite a bit of appetite to take on the research, and many of the times we were talking about issues about budget lines not being transparent and so on, issues that would seem sensitive. And the reason they were taken up is because we framed this around the government priority of food as a right that was even in their manifesto when they were campaigning, right? So it was framed within a net political gain agenda for the government, and so they were interested to listen to what we were talking about. So it's thinking around that. How do we frame as researchers what we are communicating within the larger developmental agendas of politicians? Just a slight comment on the food safety issue that has come severally and awareness creation. I think this also points out to the need for different actors when we are thinking about policy formulation, the role of civil society and community and consumer groups as part of the policy formulation processes and in the technical working groups and the national programs that are developed. Thank you.
Yeah, thanks so much. But there is a question from the Kenyan brother to to you people sitting in the government, when you meet a minister, do you tell them these things that you are telling us here today, that you are from agriculture? That's the brother is asking about. So anyone, can you volunteer?
Mr. Chair, with due respect, I think he was not asking whether what we are talking here, we normally communicate with our ministers. I was very keen to listen with interest. He was asking how often do we meet with the health people? I think that was the clear question. Yeah, so I am 1 year and several months in the Ministry of Livestock and Fisheries, so I can count how many times we have met. So in principle, we have met. The question is how often, but we have met, and we keep on meeting. But maybe the issue which I have to admit, we meet only when there is an issue. We manage crisis. I think this is not the kind of communication which I was emphasizing here. We have to have a strategic communication that provides a room for us to meet more often than not, to strategically discuss issues that affect our society. But meeting when there is an issue, it means we manage that situation. We met several times, but I think the question is we should improve, which is true, I agree. We have to improve that one. Even here, are we having people from the Ministry of Health? TNC, you are from the Ministry of Health. So we can't say we are not. Even last week, I was with the Director General of Mkemia Mkuu wa Serikali, so the Ministry of Health. But I think the challenge which I've taken here seriously is we should not meet only because we want to manage something. We have to have this proactive communication amongst each other to discuss and decide issues that affect the entire population. That's a point taken. I'm not trying to defend myself, but I'm trying to be very honest with what is happening on the ground. Allow me also, Mr. Chair, to speak a little bit on the food safety that Mrs. Goele was pointing out here. When my brother was talking about Mwani, something came to me. And I think this will be part of the awareness if this message will go to the public. I have recently learned what we call biostimulants. Biostimulants are very safe sort of organic fertilizer. And when the points which were written for me to use as a key points to discuss here was about emphasis to produce high-value crops, especially fruits, and some horticultural products. So the seaweed biostimulant is very effective and it's very good to that. If we can also emphasize to the society, to the consumers, to say consume more of the organic stuff, more of stuff that are produced from the safe fertilizers. Of course, it is also subject to you technicians to go down and look on the fertilizer residue load, either in crops or in the soil, so that we can be informed properly. 1 acre of seaweed farm can produce biostimulant that can support 1,000 acres of land to improve soil structure, soil fertility without harming, that natural environment. So I thought these issues of using alternative sources of technology or alternative sources of fertilizers should also be part of our discussion going forward. TNC, you emphasized of the awareness. I think I was the first one to say we have to create pressure cooker. Let us create pressure from our people. Because nutrition is not just people to become nutritionally safe. It is human capital aspect, but it's a national security. We cannot just allow people to consume whatever is available on the market. And for that matter, my brother, we talk about the control, the quality control. Quality control starts with what? It starts with me. Most of our businesses in the agricultural value chain, they're informal in nature. They're not registered anyway. If they are informal, that informality limits me or you to make close follow-up on their practices. What are they doing there? So if we can register our farmers, if we can register our establishments, most of the butchers, be it fishery butchers or the butchers for the livestock products, most of them, they are in the process of getting. We'll be able to track, we'll be able to say this is what you are doing, but it's not supposed to be doing that. Yeah. Mwenyekiti, nakushukuru sana.
Permanent Secretary, I think we are running short of time, so I'm now going to give the panelists each 1 minute. If you have questions, please, you can send them straight to them during the coffee breaks, etc. But if you are to wrap up, we are to wrap up this session, can you give us one take-home message from this panel discussion? If I start with you, Patrick.
My 1 minute will go as follows. One, the incentives that are making us to bring agriculture, nutrition, and health together is one, ODA for us is declining. We're no longer getting much money for each of these. Number two, the global relationships and the nexus between the three are key, so we need the solutions also have to be together. And number three, for us in Sierra Leone, we are integrating those three in a program called Feed Salone. And we have, it's the president who sits at the council, which means the Minister of Agriculture, all the ministers, the key ministers are in that council, and they meet once every quarter. There is a technical committee, again, drawn from all these ministries to advise the presidency on the implementation bottlenecks and the successes we are making. So yes, it is possible to integrate agriculture, nutrition, and health in Africa, and it's now we have to do it. If we don't do it, we're going to suffer because there's no more money coming from Bill Gates. Only Bill Gates is giving us money. The Americans have caught, the Europeans are going to court, and our resources are dwindling. Thank you.
Okay, thank you so much, Dr. Wanjiku.
Thank you. It's difficult to follow that. Yeah, I mean, I think I come again from a research perspective. I think the first message, if you are to forget anything, is for us that work in research on the intersection of agriculture, nutrition, and health, and aim to generate evidence that will inform policies, always to emphasize that diets matter, that we have to have a rethink in the way we begin our policy formulation. It's from diets working backwards, not from production going to diets. That way we think about the food safety, we think about all the other issues in the supply chain, in production, and all the incentives that are required. The other thing I also want to emphasize that was said as part of our panel is that it's important for us as researchers to be part of technical working groups and national action plans meetings that are being formed so that we influence whatever goes into action plans based on the evidence we've generated. We are part of it, so we then grow together with the teams and our evidence is able to be taken up. And not being sort of outside observers of the process, being part of the process. The third thing that I'd also like to say is that it is important to think about governance, because governance encompasses not just the policy formulation, but the implementation and moving beyond implementation at the national level, but going to the subnational level where the mothers that we want to impact are, and the women of reproductive age and the children. So also ensuring that our work gets to that level in terms of policy implementation.
So thank you so much, Dr. Yede Karib.
Thank you. So a summary of 1 minute. So number one, I think it goes without saying much more on a policy coherence, comprehensive policies. But me, as I've said, it is not just having a good policy. We have to emphasize more on delivery. Having a well-drafted policy is one thing, but capacity to translate into actions. The society is not after good policies. The society is about, the promises, the priorities contained in that policy. So for me, that one is key. And for that to happen, that coherence, we have, spoken, and I think this is an emphasis that I want to make it. Clearly, a proper, regular communication among key actors is of great importance. Number two is about investment. These things cannot happen without investing. So we invest in the actual production, but we invest in creating awareness to the general public. And then for this to happen, technology is necessary. We cannot just work on using simple technologies which will be resulting into unproductive level productivity at farm level or even at the consumption level. And then for these issues to happen, we need to put more emphasis on informed decisions. That's where we need scientists. We need scientists. Why do we take 8 months, for example, for tilapia to reach a table size? Why can't we have it only in 4 months like other parts of the world? So this is, I'm leaving it to aquaculture specialists here to what to do, but to improve, we need data system, evidence-based, so that we can make decisions that will actually support that productivity frontier. The last point is on our political will. I think we cannot do if, you know, the other parts of the ecosystems, the political system is not there. But again, taking a decision at the political level is risky in nature. So if it is risk, who should do the risk cushioning? The technicians. So the communication between technicians, decision makers, cannot be overemphasized more. Thank you so much.
Thanks so much, Dr. Salom Hamad. Just a minute to wrap up.
Thank you so much, Chair. Yeah, again, we have to realize and emphasize on how we can bridge the gap between policy formulation and implementation. Because we may have very good policies, but on implementation ways, we cannot reach on our targets. So my last message is we have to start from the community levels, the consumer driving system. So emphasize on that area on how we can improve our nutritional health. That will direct the productions and the managers what we need to do so that we can meet the consumer demand. If our community realize why we eat this type of foods, what we get from this type of foods, they can be easily change the food system, health system, and overall management system of our food and the production system. Thank you very much.
Okay, thanks so much. So we had with us Dr. Edwin Mhede, who is the Deputy Permanent Secretary at the Ministry of Livestock and Fisheries in Tanzania. We had Dr. Wanjiku Gichuhi, a senior scientist from the World Fish. We had with us Salom Hamad, Director of Fisheries and Aquaculture Development at the Ministry of Blue Economy and Fisheries, Zanzibar. And we had with us Patrick Kormawa, who is the Director of Climate Smart Agriculture and Food Security, Office of the President in Sierra Leone. These were the panelists today. I don't have to add anything. I think everything has been very well summarized by the panelists. And please, let's give them a very warm round of applause. Thank you so much. Asanteni sana.